Hi, I'm Rahul Gaglani. I'm an interventional cardiologist. I practice in the Temecula, Murrieta area. I've been in this area for approximately 10 years. I started off in the Murrieta area, and for the past 5 years, I really tried to concentrate a little bit more on the Temecula area, but I do enjoy both Murrieta and Temecula patients. Is their all-encompassing cardiac care unit. They've been doing this for many years since they've started, and they really emphasize on cardiac care. And at this point, we're able to offer as much of the tools and treatments that the larger hospitals in San Diego and Los Angeles, starting from coronary artery disease, from peripheral artery disease, and now structural heart disease. The treatment of patients, so it's not just giving them medication, it's actually doing procedures on them. In certain instances, it's improving their heart function or saving their lives. And I think that's where the greatest gratitude comes, is when I see someone having significant chest pain or in significant distress, and I'm able to help them. And obviously the greatest gratitude is saving someone's life. Initially in med school, out of all the topics that I looked at, cardiology kind of always spoke to me. What also kind of put that cherry on top is to do procedures. And I always loved working with my hands. And thinking of the combination of doing something where I have a great interest in and doing procedures really spoke to me. And then that last aspect of really helping someone and physically helping them with, obviously doing a procedure to save the life or to take away that chest pain or preserve their heart function. That was the end for me. Spending it with my kids and my wife. I have a 9-year-old boy and a 6-year-old girl, and they keep me quite busy. Oftentimes I have a hard time finding free time for myself, but it's the best to hang out with them in terms of all their activities, sports, school. And then if I'm not with them at some of these activities, then we're either watching sports together or playing sports together. So I think that really takes all my time. Besides obviously, taking their medications and following up with their doctor, it's the lifestyle changes. So in terms of nutrition, what I tell them, obviously you want to avoid certain foods like the fatty foods, the ones in high cholesterol. But what I've noticed, and this is speaking for myself, is trying to reduce your carb intake and trying to have that plan of being content with what you eat and not be totally satisfied. I think when you get to a point of satisfaction, sometimes we end up overeating. And if we eat to get content, then I think we're reducing our portions, eating healthier in that aspect. So I think in nutrition aspect, I think those are kind of important ways to reduce your weight and eat heart healthy. The other part of lifestyle is exercise. So I know it's all hard for us, and we think we walk around enough when we're doing our work and everything. But if you can take 30 minutes, ideally, but 15 minutes, even if that's more realistic, even those 10 to 15 minutes can really give you quite a bit of health. And I think those type of lifestyle changes or continued exercise programs can really make a difference for you for the short term and long term.